Addiction, anxiety disorders, depression, borderline personality disorder, trauma, post-traumatic stress disorder, bipolar disorder, and schizophrenia are just some of the mental health conditions that our guest today treats and manages. We're privileged to have Dr. Richard Bradlow from the Victoria Clinic in Melbourne to help inform our discussion. Welcome, Richard. Great to have you here. Well, we're going to get straight into this. What of all things led you into psychiatry? It's such a complicated area.
Yeah, so I think before you become a psychiatrist, you have to do medical school and a few years of being a general doctor, which is sort of general medicine, general surgery. And I think what I noticed most when I was a medical student and a junior doctor is often you'd be seeing a patient on the medical ward or on the surgical ward, and everyone would be very eager to fix their knee, but there'd be an obvious amount of emotional distress or some other sort of obvious unaddressed psychiatric illness that was sort of not addressed due to time constraints, due to people not feeling familiar with it or comfortable doing it. And it was a bit disheartening. And I remember my first psychiatric rotation, it felt like we were treating the whole person. It was the first rotation where we were addressing everything. And I just fell in love with it.
So what are the main conditions that you're seeing and that you're treating?
Well, I have a few different jobs. So I work part-time public and part-time private. In my public job, I do one job in a clinic that only treats people with opioid use disorder, and I do another day a week in being the psychiatrist in the emergency department in the Austin Hospital. So that's very varied. It's a big mix of people with sort of psychotic illnesses like schizophrenia, and also a big mix of people with sort of trauma disorders in what we'd call sort of an emotional crisis or opposed to sort of acute traumatic episode, leading to them come to the ED with sort of suicidal ideation or a great amount of emotional distress. Privately, I see about 50-50. One of my subspecialties is addiction. So about 50% of my private patients are patients presenting with an addiction of sorts. And then the other half I see sort of general psychiatry. So it's a real mix of everything.
What percentage of our population presents with mental health issues? I mean, we're hearing it in the news daily.
Yeah, so it's across a lifetime of 16 to 85, the Australian Institute of Health and Wellbeing published some stats. I mean, off the top of my head, I think it's about 1/5 of all Australians will have an episode of major depression. A bit higher will have an anxiety disorder at some stage in their life. Slightly less than 10%, I believe, will have a substance use disorder at some stage in their life. And then other mental illnesses are much more rare. So schizophrenia is about 1% of the population. Bipolar is about 1 to 2% of the population. Personality disorder of any kind, 6-7% of the population, maybe slightly higher. And all those are sort of dependent on race, gender, sex, all sorts of, immigrant status, all sorts of life experiences. So it's a shockingly high amount, I think is the answer.
Yeah. So, Richard, there'd be lots of parents and grandparents that are going to be listening into this today. What are some of the warning signs that they may see at home or on family occasions that may just create just a bit of a warning for them?
Yeah, so I think it's really difficult to pinpoint because mental illness is so heterogeneous and there's so many different mental illnesses present in so many different ways. I think the most important thing would be to have a really close and open and sort of safe relationship with your loved ones so that they wouldn't or would be less likely to hide whatever symptoms they're experiencing. So I think working on having a close-knit relationship where your child or grandchild feels able to come to you rather than fear of being judged or getting in trouble would be the most important thing there. In terms of actual things to look for, that would be across all mental illness, I would say changes in behavior, specifically becoming more socially withdrawn and less likely to engage with family members, less likely to go out with their friends, more easily frustrated. But it would also be a warning sign. But it is so difficult because mental illness is so presents in so many different ways. And I think the other thing is to look for something that's a bit more sustained. So we all have our ups and down days, and that's not a mental illness. That's normal human emotions. We're allowed to be unhappy and we're allowed to be happy. But if it's several weeks at a time, if you're noticing a change in behavior, that's when it's time to hopefully have that relationship with your loved one. You can approach them and ask them if anything's wrong. And
So Richard, if someone does see a family member who they may feel, yes, there's something unusual in the presentation of their behavior, what would you suggest their action should be?
Yeah, well, and to go back to, I think a lot of protecting from mental illness is done when someone doesn't have a mental illness. Like a lot of staying healthy and not getting a physical illness is about engaging in healthy behaviors when you're not physically unwell. So I think having that close relationship with a loved one, so that this conversation is easier, so that when you're worried about them, you are in a position to help them, is the most important part. And then just honestly expressing your concerns to the person, saying, I'm worried about you. And this is why, and this is what I've noticed. And, maybe I'm being anxious, or maybe there's something here and I want you to be able to talk to me about it. As for actually getting help, it depends on the severity. Obviously, if you're very concerned about an acute risk of harm to themselves or harm to someone else, then you call the ambulance and you go to the hospital. Otherwise, you go to your GP and you talk to your GP about it. With your GP, you come up with a plan that might be referring to a mental health clinic or a private psychiatrist or a psychologist or a public mental health service. I think it's a decision. Mental health, especially, is a decision that's got to be made joined with the patient and with the GP.
Now, Richard, I believe you place a great deal of emphasis on providing holistic care that focuses on the whole person. Just can you unpack that a bit, how that looks?
Yeah. So, I mean, mental illness is what we call a biopsychosocial condition. And by that, we mean that we know that for all mental illness, there are biological risk factors and causes, there are sociological risk factors and causes, and there are psychological risk factors and causes. And I don't believe it's adequate in any way to just address one. There's the temptation, I think, with the modern medical model to just say, well, here's some pills and that's all you can do. That's all we're going to do. But that really won't result in a good outcome. You need to also address a lot of social changes, and that includes social connectivity, finding purpose in life, and also simple stuff like abstaining from drug and alcohol and going for a regular exercise. And you also need to address the psychological component as well. So that's making sure someone's linking in with psychotherapy, whether it's provided by me or someone else. So I think you need to have a really holistic picture of the whole sort of patient, what's led them to walk through your door that day. And then another key part of it is that you need to share that with the patient. Your doctor and you should share what's going on, should have a shared understanding of what's going on, and have a shared idea of what's going to happen going forward. Because mental illness is not like so if you, I always say it's orthopedic surgery versus abdominal surgery. So if you get an appendicitis, you'll have terrible abdominal pain. You'll go to your surgeon. You'll cut out your appendix. You'll lie in bed for a few days. You'll take some antibiotics, and then you'll feel great. And that's it. You don't have to do anything like that. But if you need a knee replacement, you need to do months of rehab after. Otherwise, if you don't do that rehab, you can end up in a much worse position than before you got the knee replacement. Mental illness is a lot like that. You need to engage in the process of getting better. Otherwise, you can end up in a worse position.
Richard, my next question kind of probably moves more into the space of addictions, but how does your treatment look in terms of someone that does suffer from addictions? It's probably, I'm talking about substance abuse, in terms of their assessment, then maybe detox, rehab, and then possibly moving into safe and meaningful social connections.
Yeah. So for addiction specifically, it does depend on the substance. Some substances have quite a dangerous withdrawal process, so you'd need to go into a hospital to do that, and that would be alcohol or GHB. The rest of the substances you essentially don't necessarily need to go into hospital to withdraw from, as they don't have as severe a withdrawal. But I think people can get, as you sort of touched on it, people can get locked in to the early parts of the treatment as sort of the whole game. So just withdrawal and getting on some medications and doing some psychotherapy. But really, most treatment, or in terms of most recovery in substance use, is in the months and years after. If you just do a sort of withdrawal alone, or a medical assessment then a withdrawal, I think you have a 70 to 90% chance of relapsing within the first 6 months. So it's all about the connections after, and that's why peer groups like Alcoholics Anonymous or Smart Recovery are so brilliant, because they replace that purpose in life that the substance use had. If I'm addicted to heroin, my whole day is taken up by my heroin use. I have to wake up in the morning, I have to work out where I'm going to get the money to get the heroin. I have to then find the person to get the heroin. I then have to get some needles, and then have to find a place to inject the heroin. That's a whole day and purpose. It's not enough for me to just stop using heroin. I need to replace all that purpose in my life. And that's what really a lot of recovery is about. It's about finding a new group of friends, a new purpose in life. And what most AA or NA things groups say is, you have to do 100 meetings in the first 100 days of sobriety. So it's really jumping on to really making sure you're not sitting around with idle hands every day. You're making a new group of friends. You're finding a new purpose immediately. To address that question, you see your GP, you ask for a referral to a drug and alcohol service or a private drug and alcohol service. You link yourself in with, you probably need an addiction specialist online, probably need some sort of addiction counseling, and you try and replace the sort of the meaning that substance use had in your life, and replace your friendship circles, or try and get your friendship circles to change their habits. That one can be harder.
And changing the dial just a tiny bit. I mean, many people watching and listening in this morning may not be suffering from mental health or substance abuse issues. What suggestions would you make for those folk to maintain optimal mental health?
I think the best thing you can do for your mental health, but unfortunately not really within our control, is to have had a secure attachment with your parents. But I think it's really important to keep in mind for people with kids and grandkids, is the best thing you can do for your children's mental health or grandchildren's mental health is to have a secure attachment with them. And you can always address your attachment patterns by doing psychotherapy or getting into a secure relationship, a healthy relationship with someone. And that doesn't have to be romantic, it can be platonic. Outside of that, I think people need purpose and a happy, healthy social life. So it's not, we're beings that need to be doing things. So we need something to fill our days that brings us a sense of achievement and joy, and we need people to do that with. And then more basically, we need to have a healthy sleep pattern, abstaining from drugs and alcohol, having a regular exercise, half an hour, 5 days a week, of a simple walk, and meditating regularly. It doesn't have to be transcendental meditation, but 5 minutes of mindfulness meditation would be brilliant.
Very interesting indeed. Richard, before we started our discussion this morning, you were describing to me some information about the current PhD that you're undertaking. Can you just give us a quick synopsis of what you're going to be studying at this stage?
Yeah, it's very niche, but so there's a form of neuropsychiatric illness called functional neurological disorders. So that's when you have a neurological symptom that doesn't have a solely neurological origin. So the simplest one is, a lot of people get seizures that don't have an epileptic origin. So we call them functional seizures. So they have a sort of what we call neuropsychiatric origin. A lot of people have leg weakness or tics and that sort of thing that are also similar. So my PhD is specifically in the trans population and those conditions that we call them functional neurological disorders. And they've been found to be overrepresented in the trans population. And the trans population's been found to be overrepresented in FND, in the FND population, the functional neurological disorder population. So my PhD is about sort of exploring why this is, and then how can the healthcare system better cater to this population. But it's very FND is a very actually a shockingly common condition, but not a very well known about condition. I think estimates are sort of 5 to 10% of the population have a functional neurological disorder.
Richard, been very, very insightful and very interesting talking to you today. We're very aware that mental health issues are a major social issue today around the globe, for that matter. And it's been great to have your insights, your experience and what you're doing. We wish you well with your studies, and we wish you well with all of the work that you're doing for our community. And thank you for being a guest here at Monday Matters today.
Thank you so much for having me.